And welcome to this video. This video is pretty much for caregivers, speech pathologists, anybody interested in learning more about the speech pathology field, especially the caregiver who is searching for services and wants to make sure that they get the best care possible. One of the things I'd like to speak with you about today, very briefly, is something called continuity of care. That's right, continuity of care. And what continuity of care means is that care is regular, it's expected, it's consistent, and it is performed in a way where everyone is comfortable. The family is comfortable, the patient is comfortable, the speech-language pathologist is comfortable. In today's society, and in many outpatient centers across the country, there are times when a patient may go for care and initially be evaluated by one particular therapist, and they hit it off great. They come back for therapy and there's somebody else there. And the patient goes, gosh, I was waiting to see the person who evaluated me, who I really, really liked, and now I've got this person, and I was really looking forward to seeing that person again. Well, you know, it just goes to show that if a person gives you care, then quite often, when and if possible, most people would like to work with that person again. And so I think it's very, very important that if you've been evaluated by a particular speech-language pathologist, or if you're being seen by a speech-language pathologist, that you have your care performed by that person. I mean, quite often, there are sometimes a person comes in for therapy and one day they'll see one therapist and the next day they'll see somebody else. That's not continuity of care. I would strongly suggest that you keep the continuity of care. If you find a speech-language pathologist who you like and who you know that you get along with and you know that they can show you things that help you speak better, do your very best to request and to be very, very persistent in wanting to work consistently with one person. I believe that's very, very, very important. And so, continuity of care, it's having a speech therapist who you know is going to be there. It's having a date and a time when you are supposed to be getting your therapy. You don't want to go to a place that'll schedule you one day and then won't schedule you for a couple of other days. You want regularity of care. Regularity of care with times, regularity of care with a therapist. Regularity of care. That's so very, very, very important. Thank you very much. This is Mark Ittleman.